My name is Joey Pricks. I have the butt that's been seen by the world. My butt went viral. I had a UK journalist find me on social media and wrote an article. From that one article, there were YouTube videos made. At this point, I've spent about $60,000 and I couldn't be happier. I have 350cc solid silicone butt implants. It was by far the most painful thing I've ever done to myself. I couldn't sit for 6 weeks, but it was worth it. Growing up, me and my mom always used to watch plastic surgery shows, and that had a huge impact on who I've become to this day. Being able to see people like tweak themselves and be so much happier after, I loved it. So I first started modifying myself when I was 15 years old, and I started going tanning. I would wear colored contacts. I get Botox, I get lip fillers. I literally pierced everything except for my earlobes. I skipped that because that's boring. I've had the sweat glands from my underarms removed. I haven't sweat since the procedure. I wouldn't say I'm obsessed with plastic surgery. I would say that I'm a plastic surgery enthusiast. I got my first nose job when I was 21 years old. The doctor put an implant over my nose. It was a nightmare. After 6 months, it slipped down and broke through my septum. I realized that the implant had slipped because I was using Q-tips to kind of clean inside my nose, and I felt something really hard. So I went to the surgeon, and he tried using a clamp and scalpel to try to trim it, and then just kind of like push it back into my nose and then hope it was gonna close over. It didn't. So I went in for surgery to have the implant removed. When I woke up from that surgery, my nose was really bumpy at the top. My nose is like a canvas that's half painted. It's almost there. It just needs a little tweak and just a little finishing. I want this all flattened out because where the implant was, it was kind of just masking the bump that wasn't done the first time around. I'm pretty much just on a quest of reaching my own kind of plastic perfection.
All right, y'all, here we go. Right foot, we're walking 1 and 2 and 3. Take that left hand again. Take that left foot up to the pole. Swing it around, right leg up. Wiggle it, drop it, hold it, bounce it, bounce it, bounce it. What you mean your butt doesn't move?
It's rock hard. My butt doesn't move because it is just 2 solid pieces of silicone. There's no jiggle to it whatsoever.
Don't be afraid to take that outside hand and just trace that body down. Okay, show off. Okay, you better do it. Yes, there you go.
I don't dance, but if I find myself in front of a pole, I know how to throw myself upside down and slide all around.
Hey, yeah. Yeah. Oh, yes, there you go. That was so awesome, you guys. Thank you both so much. Take 5, y'all.
Awesome, thank you.
Yes.
Oh my God, I'm sweating. Ugh.
Good thing I can't sweat.
I know, right?
That was probably one of my favorite procedures I ever had done, is getting my sweat glands removed and not sweating.
It kind of makes me want to do it myself.
Oh my God, you totally should. I'll bring you.
Yay.
Speaking of procedures,
Yeah.
I'm going to see Dr. Nassif and Dr. Dubrow. I want them to fix my nose, because you know, I look up to them.
Yeah.
I approach piercing the way they approach surgery.
Remember that girl that you had to fix her piercing? Like, the doctor didn't know how to take it out, so he cut a whole triangle, right?
Well, that's what you get when you're going to some place trying to save money. I am a creative and aesthetic body piercing artist, but I also specialize in revision piercing. When people mess up, I fix their mistakes, just like the doctors.
And what do you think they're gonna say about your piercings, though?
They're probably gonna be so overwhelmed and shocked by me.
You're so sparkly. They're gonna be like, whoa, I need sunglasses.
Okay, when I was single, I basically had girlfriends where it was exclusive for a period of time. You've been divorced for how many years now?
4.5 over.
4.5.
I've had girlfriends.
1.
It's too hot in here. Hold on.
It's funny how certain topics will make you sweat.
No,
but this
you
is
won't
definitely
know
a
the
topic
phone.
that makes you sweat.
Yeah, the girls.
Yeah. This definitely raises your metabolic rate because you're afraid I'm gonna touch on something embarrassing.
Is that what it is?
Yes.
Keep talking.
Yeah, it's the topic, no question. Okay, I'm gonna say it. I just love making Paul sweat.
So we have a patient from Boston.
Oh, okay.
Name is Joey, and he's had a couple of rhinoplasties.
Do we have pictures?
We do have pictures. Let's go.
See. Whoa.
He's an enthusiast.
He's enthusiastically into plastic surgery.
Okay, let's look at his nose for a second, his profile. Oh, wait a minute. Is that piercing in his cheeks?
Oh, wow.
Look, he's
Oh,
got
my
piercing
God.
in his buccal area.
Oh, come on, we gotta meet this guy.
Can you please send in Joey?
If I had to get a piercing, it would be in Paul's right nipple. So I could just pull on it and bring him into the exam room when he's talking too much.
Hi,
Joey?
how are you? I'm
Dr.
Joey.
Nassif.
Nice to meet you.
Hi, Joey. Terry Dubrow.
So nice to meet you.
Taylor?
Meeting Dr. Nassif and Dr. Dubrow is so exciting. I'm a little nervous though at the same time to see what they have to say, but I'm pretty sure they'll be able to give me exactly what I want.
You came from back east?
Yes, south of Boston.
Where?
Quincy.
Quincy. All my relatives are from Hingham.
I pierce right next to Hingham in Hanover.
Oh, really?
So I probably pierce your family.
Nah, I don't think you pierce. They're a little bit too old for that. I don't think
You
so.
never know.
So that's what you do for a living. You pierce people.
Yep.
How many piercings do you have?
I have about 50 piercings.
50.
Yeah.
Do you have any in the private areas?
Yeah, on the frenulum.
On the frenulum. Okay.
Yeah.
So the lower. Okay.
Yeah.
Do you have any in the anal rectal area?
Kind of.
Do you have one on the taint? The area
Yes.
between you do. You know the taint?
Yeah.
Taint? You're really asking this guy about his taint.
If someone said, "What's the taint?" What would you say?
It taint the ass, it taint the ball, or something like that. Someone has
It taint the ass and it taint the balls.
Who knew that after this long a period of time of being a board-certified plastic surgeon, I would learn something new about human anatomy?
All right, well, let's get to it then. Your nose.
Yes.
2 rhinoplasties. Tell us about that.
So during my first rhinoplasty, the surgeon put implant that went over the bridge. It went from pretty much there to there.
It's just weird because when you have already a nose that's sticking out a good amount, you don't add a silicone. Was it silicone or Gore-Tex implant?
Gore-Tex.
Sometimes, if you're over-aggressive, taking a bump down, and you go, oh!
You took too much.
You can take that piece off that you took off and put it back on, but if they filed it, you can't put shavings back on. So I suspect he was, as a salvage, he went, oh, and took a piece of Gore-Tex and just laid it on there.
Yeah.
So then what?
Well, the implant had slipped down and broke through my septum.
Inside your nose, did you see it popping out?
I didn't see it, I felt it.
Then you went back to the doctor?
Yep.
And then what happened?
They wheel in a rhinoplasty surgical kit. He clamps onto it uses a scalpel.
Just right there in the exam room?
Right there in the exam room. So he uses a scalpel to try and trim it and tells me, don't move. Okay.
Oh, he's just
so
gonna
I'm
trim it off
trim
and
off.
leave
He
it
was
in.
gonna trim it and push it in
yeah,
so
like
it hopefully.
that's gonna work.
It's like an exposed breast implant.
I know.
Joey is extraordinarily lucky that he didn't suffer a very significant infection by having the exposed implant pushed back in, because once it becomes exposed, it theoretically becomes colonized with bacteria, and if you put it back in, that bacteria can then continue to grow and form a very dangerous infection.
It obviously didn't work. It was hanging out more after. So I think it was about a week and a half, 2 weeks later that I had been going in for surgery to have the implant removed. So when the implant came out, I'm left with just kind of like a bumpy, where I would like it to be like thinner.
Thinner.
More like chiseled.
So it's all about your nose, right?
Well, I figured while I was under,
Yeah.
you could possibly make my butt implants a little bit bigger.
Really?
Just get it all done and over with at once.
Do you have any problem with them?
No. I think they're a great start.
Yeah.
But a little more projection would be.
All right, well, we'll look at that area.
Best thing to do is go in the operating
Yeah.
room and examine you, okay?
Awesome.
So let's go do that.
You have how many piercings?
Like 50-ish, yeah.
Wow. Can
All right,
we
let's
see?
start. Wait, hold on. You ready? 1, 2, 3, 4, 5.
I approach body piercing the way the doctors approach plastic surgery because we're creating an open wound. We're putting something in the body, and you need to make sure it's going to heal properly.
And the taint one is right there?
It's right There.
Can I see?
Yeah.
It's closer to the butt. Right? Did you measure the distance between the and that's it? Split it in two?
No.
You
I
just
just marked
estimated
where it
it.
was going to be aesthetically pleasing.
You're fascinated with his taint. It's his taint, right?
Dr. Dubrow is looking at my taint under hospital lighting, basically. Usually it's only seen in moonlight.
Once you get up, let's show him, since you want him
Oh, yeah,
to
let me
look
see
at
the
your
buttock.
buttocks. And especially your incisions, too.
Yeah. I think he healed really well. These are big. You know, you're actually very lucky, Joey, because every time I've seen implants this big put in, even though done properly intramuscularly, they move and they're a problem, and you've done really well.
Well, I was really good about not sitting for 6 weeks, so I think the pockets really developed.
The fact that Joey has done so well and looks so good, it's better to leave well enough alone and not take on any risk of any new possible complications.
Trust me on this. You've been fortunate.
Yeah.
Because when you put a very large implant in a very tight compartment, that's the tendency for the body to reject it.
Okay.
Your body right now, very happy.
I do love it, so I will
Leave it, right?
absolutely take your word.
You will?
Yeah.
I'm so happy about that.
All right, now let's talk about your nose.
So let's look at the nose, yeah.
All right, let me feel. Lower your chin. Bones already were fractured. Okay, look at the symmetry.
Yeah, he just felt he over-reduced it for sure. Yeah, he was salvaging it.
Usually when you have an implant in the nose and it's taken out, it leaves damage. But in Joey's situation, his nose is very symmetric. I can understand why you might want it a little bit more narrow, but it's too risky. You know, I gotta tell you, your bones have already been fractured. When you fracture it again, it's gonna cave in, it's gonna collapse.
Like you really don't think just like
No.
smooth?
You mess with it, I'm telling you, there's about a good 50% chance that the symmetry that you have now will be gone forever. You can never get it back perfectly.
Yeah. I am pretty upset that Dr. Nassif won't touch my nose, but I understand if you're not comfortable doing it, you don't do it.
How often do you go to Boston to see relatives? You're there occasionally, right?
Yeah, once every year.
So if he comes by your shop and
We
he
can
won't,
pierce your taint.
Listen, it's a pleasure meeting you.
It was so nice
Again,
meeting
listen,
you.
I hope you don't hurt yourself,
yeah.
because you look great.